Good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to cover a subject here that's been real. People have commented on so many times on, can you move a tooth into a space where you've extracted a tooth, or where there's a gap there? Can you put a tooth in there? And can you put a wisdom tooth in there? Yes, you can. And the answer is you can put anybody's tooth as long as they're living into a gap. Even if the gap has been there for a long time and you have a knife edge ridge of bone, the tooth, it'll just take longer to do it. It'll open out and come on in to that space. And I'm going to show you a case here where we've got multiple missing teeth and lots of different stuff, and we just pulled everything from the back to the front and filled the whole mouth up except for one area where there was only one molar. She needs a one implant back there, and that's it. And they sent the patient to me to upright some teeth so they could put bridge work in and extract the wisdom teeth and stuff. And I started working on this lady, and we just, so we can move these teeth forward, and we can use these wisdom teeth. So let's get started on this. I'm going to have to get this. And here is the models of the lady when she came in, and I'm sure I've got her name on here. But anyway, this is a closed bite. You can see it right here. And you can see this jaw is being held to the back by the way this tooth comes in contact here. And she can have a TMJ problem where the fossa, the condyle, is being forced back further in here by the way this would be the condyle coming in. And if when a tooth meets back here, this can cause a TMJ problem where you can traumatize the retrodiscal tissue in this area like that. And the same thing over here. This tooth was sitting back here at one time. The extracted teeth here, this was leaned over. So we're going to upright a tooth, and we're going to move teeth forward into that space. There's a wisdom tooth up here. We're going to bring it in, and we're going to take this wisdom tooth. We're planning to remove it, and I mean that's what they wanted to do. And we move these teeth all the way, not only one tooth, but you can move the whole blooming group forward. And it doesn't matter. This lady is 50 some odd years old when we started, and sorry about her name up here, but didn't bother her. But we have shown this case in full. If you want to see it, just go look on closing space on adults. Now here the case is, you can see the gap. You can't see where the wisdom teeth were, and we're going to straighten that. The lower teeth were hitting right here, worn that down, and here these are crowded lower anteriors. We expand the cuspids, and we do all sorts of things that people said you can't do this. It's just people don't want to get into adult orthodontics. I've been trying for years to get more people doing adult orthodontics, and I mean they don't even like to do early children orthodontics. The pediatric dentists will do that, but they don't cover adult orthodontics. They just don't want to. They don't want to do it. That's the fact. And there's just tremendous amount of adult orthodontics out there right now that's just going without anybody to treat it. And people come in and comment, and they go in and take it in to whoever's working on their teeth, and they say, well, you can't move this one, it's a wisdom tooth. This is a bunch of malarkey. I'll call it a nice name. All right, well, let's get started on the case. here is the first x-ray that we took on this young lady, and here's what we're planning to do. We were going to take out some teeth. We're going to remove these wisdom teeth, and we were going to put a bridge in here, and that's what they wanted to do. We wanted to upright this, and I guess you'd bridge both spots in here. So let's see what we actually came up and did here. So I got the tooth ready to go, and I just felt like this is not necessary to do. Let's just move the teeth she's got together and see what's left in here. So we take this side. We didn't have to close all of here. Over here we did. Now we brought these teeth forward in here. Let me go back one x-ray. You see this tooth right here will follow in here, and we didn't extract a single tooth she had. We used every one of them in here in restored, and this is what I'm calling it, restorative dentistry, using orthodontics and people's natural teeth. Hadn't you rather have some natural teeth rather than implants? Implants and bridges are fine where you can't put anything else in there, but if you can put your own teeth in there, it's by far better, and the bone structure will grow around them, and you can show it to a dentist 10 to 3 years after you're through there, and he can't tell, looking at the bone, it's not like it was. I mean, he can't tell what's been moved and what hasn't been moved. And so here we go. Again, we've moved those teeth, straighten them up. You can go through this and take your time doing this. At this point, she's 49 and 6 years old. So before we finish, she'll be 50-something years old in here. So we keep moving these. We upright the teeth, pull them together, go back, and we have this video that thousands of people have looked at it. And we were trying to get orthodontics schools to teach adult orthodontics. And there'll be so much orthodontics there, they can't possibly do it all. And they'll get, anybody can work on that. And lots of parts of orthodontics can be done with people with very little training. And we ought to teach it in the schools. They don't have to do it. They just get somebody else to do it and work as a team, have somebody who knows how to restore the teeth, and if you get somebody to do the orthodontic work together like that. And then somebody finish the thing out and everything. So here we've gotten this far without anything else. Now, back again, you see this tooth, it was a wisdom tooth way back in here. Now look where it is. Let's go back just for a little bit. See that tooth sitting back in here? And people say, oh, that's a wisdom tooth. It won't move. That is a bunch of bull. That tooth will move just like any other tooth. It's made at the same factory, and it's made out of the same stuff as the rest of the teeth in the mouth. And that tooth can be moved if you get rid of it. Watch this tooth right here move. Now, when I move this up, see it's underneath there. All right, it was back here. This tooth will come down and touch on that later on. Now, here it is. This tooth is going to come around and get underneath that tooth, and we'll leave a little bit of it here. So when this one erupts in, it can touch something. Now over here, we did not have a tooth to fill in. Then you can put an implant in here, that's fine. They're wonderful, they're good, but they're not as good as your natural teeth. At least that's my own opinion. And here is the seventh x-ray we took, and you see this tooth that was back here, it will erupt up into the teeth right like that and fill in that space. And over here, the x-ray is kind of bad, but there's no tooth here. This is where we could use an implant. Here is the finished product. And this is, I'm not pulling your leg or anything. This is the same woman that had those teeth like that. And here on the side over here, and here is the side. There's one area where you need an implant back here to take over that. But that's the teeth that we started out like you saw over there. And here is the lady. She's a very nice, attractive lady, and she has a nice set of teeth now. And we have done a full video on this several years back, and you can go find it if you want to. And there's thousands of people have looked at it. And so I'm trying to get orthodontic schools, people that are training people to be orthodontists, to learn how to do adult orthodontics. And now some of the schools are doing it, but there's some of them they don't want to do it. They don't want to get into adult orthodontics. But there's more of it out there than we could possibly do. And I'm going to say, wherever this goes, I am pushing to get adult orthodontics being taught in all dental schools. If a person is just a dentist and doesn't want to do orthodontics, but if he knows what can be done orthodontically, it will affect the way he diagnoses the case. And it will affect the way where if he gives the patient an alternative. If the patient doesn't want it, okay. Do it, just take out the teeth and put bridges and all that other stuff. Or if they want to use their own teeth, then send them to somebody or let somebody do it that can do it and knows it. And you take your case, you go, if you're not a dentist somewhere and you read this and you're thinking about doing it, take the blooming picture there to the dentist and let him look at it, or whoever's straightening your teeth. And if he doesn't want to do it, see if you can find somebody to do it. Thank you for watching, and I hope we will reach people all over the world. I get comments from people from everywhere you can't imagine, and I can't even answer all of them back, but you can look at these videos and see what can be done, and you can restore dentistry, restore the teeth in your mouth if you have good, healthy good bone structure and everything. If you got some problems, if you take care of it properly, you can still do it too. So thank you for watching, and I'm on a hush, and I don't mean to be fussing with people, but I have been trying to do this for years. I started out straightening teeth in 1956, and it took me a long time to really learn it. I tried to get them to teach it in the schools, and they said they won't do it at my own school. And so I said, if you're not going to do it, then I'm going to try to do it. And this is what I'm trying to fill up and trying to do. I want to teach people all over the world what can be done, and if you have somebody that doesn't know how to do it, they can take these videos and learn a lot about it. They need to get back to somebody to help them. But thank you for watching, and I'm going to say goodbye and hope that this has some effect on people, that this can be done. Age does not matter. It just is maybe take a little bit longer, and you can upright, you can move a tooth into a space. If you, the best time to move the tooth in there is immediately, like you extract a 6-year molar, it's rotted out or it's gone, and you want to move the second and third molar up there. start the day you pull the tooth out, or whoever does it. It stops the bleeding and everything, but have your braces all ready to go on, and just put them on before you do extraction, and then just pull that tooth into that space. We'll show you how to move the tooth forward bodily into the space, and that's the quickest time you can do it. You can do it 20 years later, but you'll have a knife edge of cancellous cortical bone that's really tough to go through, but it can be done. So I'm going to say goodbye, and I hope that this will reach home to a lot of people, and I'm going to stop.